Some of us will remember Dr. Chike Hekwezu as the DG of the NCDC right there in the middle of the pandemic in Nigeria. He's now, as you've seen there, he was at some point Assistant Director General at the General Emergencies Program of the World Health Organization. But here now he is joining us as Acting Director General, WHO for Africa, and he joins us virtually. Thank you so much for joining us this morning, and it's good to see you again, Dr. Hekwezu.
Good morning. It's great to be back on your program, and good morning, Nigerians.
Good morning. You look a little more better, way much better relaxed than the last time I saw you. But hey, now let's get into it because we don't seem to have much time. Two issues very, very quickly, and let's see how much time we can cover. First is the issue of course, one thing that is trending, the fact that the United States of America has pulled out of the WHO, which I think one or two other countries have also followed suit. What do you think, first of all, what could be the reason for that will help many people understand that, and what are the implications?
Thank you. So it's important to remember, WHO is a 75-year-old organization. It's actually an organization that is defined by its member states. So every country, when they joined, came together around the world and decided, listen, that there are public health challenges that we have to face collectively as a world in the different regions. Despite the efforts each of us can do in our countries, we have to come together to tackle some issues because they're too big and affect all of us, and we have to do it collectively. So at the heart of WHO is actually a member state organization, a community of nations that came together. So to be honest, if any single country decides to leave, of course it's unfortunate, and we have continued to hope that the decisions by the United States government may change, given the work that we all are obliged to do together. But ultimately, we respect that decision. We continue to work to support countries around the world. I work for the WHO Secretariat, so all the functions that we carry out are carried out on behalf of and in support of our member states. So, the successes of this organization and the work we've driven around the world, speak for themselves, driving the polio elimination efforts, polio very close to elimination, following smallpox eradication, supporting countries every time there's a significant incident. Today there's Marburg in Tanzania, there's Ebola in Uganda, all over the world. There are challenges that we cannot deal with on our own. So it is that collective effort really that defines the work WHO does at all levels. At the country level, we have a very strong country team in Nigeria. At the level of the African continent, which I'm privileged to lead for the next few months in an acting capacity, but also globally from Geneva, with our colleagues really working in collaboration around the world, addressing the health challenges that we have to deal with collectively.
But there are those who would say, given some of the issues that President Trump raised and all kinds of allegations, that preceded this whole conversation, there are those who would wonder, isn't this a demonstration of mistrust or lack of trust or diminishing trust in the WHO?
So if you look at all the issues the president raised, we have addressed each and every one of them. In terms of WHO representing the values and the transformation that it needs to see internally. During the tenure of Dr. Tedros, who has led the organization now for 6 years, there have been incredible reforms within the organization to serve our people better. We see countries growing in their own capabilities. We see new emergent institutions of public health. The Africa Center for Disease Control is a good example here on the continent. But within WHO, we have grown. We continue to support. We will not be defined by one or two of those statements. We continue to work very actively. It's very important that we explore the opinions of the leaders of the African continent. In my previous position as director of NCDC, I can tell you how much I relied on the the resources, the opportunity, the technical expertise that WHO provided. So I think every country has to look inside itself to decide what benefit do I derive as a country with having WHO in our country, supporting us, standing next to us. What benefits do we derive as part of a global community? So when something happens somewhere else, we are also informed and we have an opportunity to address this. So I think every country has a right to make those decisions, but we in Nigeria should rely on the benefits that we derive from the organization to make our own strategic decisions on whether or not to continue to engage with an organization that has done so much for us over the past 75 years of the existence of the World Health Organization.
Well, you didn't quite address whether or not that it's a demonstration of mistrust or lack of trust, because there are those who, a good number of people, you know, all of the issues that were raised around the COVID vaccine at the time, and there are those who are saying, okay, you know, this happened to me, that happened to me, and then the U.S. president is making this an action from the president of the United States, even if it is whichever way we want to look at it, it is significant. It represents one of the biggest nations in the world. So does it in any way demonstrate a lack of trust?
He does, I agree with you, but there's little ambiguity on the lives saved by the COVID vaccine around the world. Our challenge on the continent is we did not get access to these vaccines as rapidly as we should have. And this is being addressed through many efforts. There's a big effort to improve our local manufacturing capabilities across the continent. We recognize that the speed to deployment of vaccines needs to be more equitable globally. That is why in WHO right now, we're in the process of working with all our member states to agree a new pandemic treaty. So whatever instruments we have when there's a threat, we can ensure that every country has access to them very rapidly. So, there's very little debate within the scientific community, actually, and the numbers are there to show it, the number of lives saved. We have a lot of work to do collectively to regain the trust of the people around the world. This has been one terrible pandemic that really challenged all of us. But the next one is around the corner, and we need to learn from the mistakes that we made rather than think of discarding the baby with the bathwater. The threat of infectious diseases are there. They haven't disappeared because we were unhappy with certain things 3 years ago. So, I was front and center of this response, and yes, we struggled with winning the trust of people. Even in Nigeria, there's no ambiguity on the scientific validity of our efforts. But we have to understand we live in a complex world. People have all sorts of theories about so many things, and we have to keep winning their trust so that they can trust us in their response. It's the same thing in any other sector. The banking sector has to win the trust of their consumers. The army, the military has to win the trust of Nigerians. So in every community, we work in public health. We have to win over the hearts and minds of people. But the evidence is there. Listen, in our father's generation, if you were born in Nigeria, you probably would have a life expectancy of 30 or 40. But because of the advances, because of vaccines, the single intervention in modern medicine that has saved the most number of lives are vaccines. The fact that when you have a child, you take them for vaccination, they no longer have measles, diphtheria, tetanus, whooping cough. All of these are the diseases that are in our father's generation. Our fathers, not that long ago, would have succumbed. But today we have an opportunity to live on average 50 to 60 years, and we're pushing to make it even longer. So the advances of modern medicine are really unambiguous, and we have to communicate to people so that this apparent mistrust, which is really driven by conspiracy theories more than anything, is minimized, and we regain the trust of healthcare providers across board, from your frontline providers, national providers, and of course organizations like the World Health organization.
If you can do this in 30 seconds, just so we wrap up this trust thing, you've repeatedly said that there's a need to win trust of people and all of that. And you just mentioned that one of the ways in which this mistrust or distrust could have grown is through conspiracy theories. So if that in any way validates that there is diminished trust, how bad is it?
Trust is one of the hardest things to measure, but on all the things we do. So it's very difficult really to say how bad it is, because sometimes the people with the loudest voices get a lot of airtime and are given a lot of space. But, if you think about it, we still go to doctors every time we're ill. The reason we go is because over the past 200 years, medicine and science has developed a set of countermeasures that alleviate illness. These things don't happen through miracles. They happen through diligent research that has gone on and continues to go on as we find new medicines, new cures, new ways to prevent illness. So it's very important that we as a medical, scientific, public health community learn to communicate this a lot better, that those things that enable safe childbirth, to enable our children to survive, to enable when you go to a clinic, what happens? None of that happens through miracles. They happen through the diligence of scientific discovery that goes on every day, that has led us to these opportunities, that has driven longer life expectancy. But, as scientists and as public health practitioners, we may not always be the best at communicating the benefits of science to our societies. And we have to get better at that and realize that the times have gone where it was enough to just do good or support people and improve their lives. Now you also have to explain to them in detail. And that's what we're learning to do. It's a new journey for many of us, but we're on that journey. And we're here together with the government of Nigeria, Nigeria's health sector parastatals. All of them are doing very well. You can see the work NAFDAC is doing, the Nigeria Health Insurance Agency, the Nigeria Center for Disease Control, which I was privileged to lead for many years, the Nigeria Primary Healthcare Development Agencies. All these are parastatals of the ministry that the World Health Organization works with, so that everyone's effort leads to a collective benefit for society.
Talking about the work that the NCDC is doing, I mean, you definitely have a lesson or two that we need to learn. A good number of people watching us right now and listening to you would recall the tremendous resources that were raised both by the government and the private sector during the pandemic of 2020. Now, we also see that a lot of infrastructure were put in place at the time to ensure that such things, should we even have any situation like that again, we are better ready for them. But there are those who can query whether or not those things are still as valid now as they were before, because some of those infrastructure are derelict. Some of them are just standing there, growing dust, growing grass, and all those things. Is there something we missed in terms of those infrastructure that were evolved at the time?
I think this is a question best posed to the current leaders of the health sector. But what I can say for sure is we may not be where we want to be, but we're definitely in a much better place than we were in 2020. And a lot of the investments, let me give you one example. One of the biggest challenges we had at the beginning of the pandemic was oxygen capacity. So the capacity to provide medical grade oxygen for patients coming in respiratory distress to any hospital. At the beginning of the pandemic in 2020, we did a survey. There were only 200 functional intensive care unit beds across the public sector in the entire country. And so a lot of work has gone into that, in improving that. And that is not only important for the next pandemic, it's important for so many other medical conditions that you might need to address today. So I do think that there's a lot of progress that has been made. I think we can be very proud of that. But, unfortunately, a lot of the work that we do in public health, whether it's the supply of medical oxygen, the example I just gave, or functional laboratories or emergency operation centers, none of them are big projects that are visible to most Nigerians. So, but it's a bit like an insurance policy. You don't want to think about it every day, but you want on the day that you need it for it to be there for you. So it's a constant building process. And I'm confident that the leaders that took over these agencies continue to push hard so that we stand tall, just like we did in 2020, 2021, when we were confronted by this huge pandemic. Everyone thought that Nigeria would collapse. We are proud that that did not happen. We should be proud of it, and we must continue to push so that our health parastatals are strong enough to solve problems like this should they arise. One thing is inevitable. Emerging infectious diseases is a continuous threat. Nothing else has brought Nigeria to a standstill in our modern history, across the country, across all states. So we must take the threat seriously and devote the necessary human resources, intellectual capacity, and financial resources to continue to work very hard. And on all these tracks, the World Health Organization is standing shoulder to shoulder with all the health parastatals and the coordinating minister for health to support him in his efforts in Nigeria.
It's something that you said repeatedly, well, at least quite a few times, when you were DG of the NCDC. And it's a phrase, the next pandemic. And it would seem like you said at the time, this is not going to be the last. The first one took the one we knew, took about 100 years before it came. And here we are, 2020, and you said quite a few times that the next pandemic may not be that long. I don't want you to prophesy when it's going to come, but I just want you to, is there anything we can do to prevent or prepare for it in case any such thing occurs? Because if you remember, we were literally scampering during the 2020 COVID-19 pandemic. We were literally scampering. The world was literally scampering. So if you can talk to us about that.
So I agree. We all remember with a bit of trepidation the challenges we went through the last pandemic. And when I say the next one is coming, I don't want to be a fearmonger by any stretch of imagination. And the reality is that every single day in Nigeria and countries around the world, we detect, WHO and institutions like NCDC, small clusters of unusual diseases. We see clusters of cases, clusters of deaths. Very often, there's a rapid control effort carried out. And by those control activities, we are able to isolate the cases, keep from transmission from happening. But we have to remember, these pathogens live with us. They live among animals, in the forest. They live in our environment. And the environment in Nigeria, in the tropics, and in many other countries where there's very close cohabitation between animals, humans, and the environment, the likelihood of a new pathogen emerging is always there. What we need to do, this is exactly the same thing I said while I was at NCDC, that we need to develop the capacity so whenever we see an emergent incident, we're able to detect it early, respond, and stop it from transmitting to others. And we've gotten better at this, but we need to keep pushing. It's a constant battle. But, viruses are very smart organisms. They keep evolving. And this was the challenge during COVID. The virus we saw at the beginning wasn't the virus at the end. It kept evolving. And we have to develop the institutions to keep tracking this every day. But I am confident that we have good teams across the country. This is at the heart of the work WHO does, both for old existing viruses like polio and the new ones. But it's a constant battle, Ayo, and it's something that we have to keep pushing at every single day.
There are so many questions I would have loved.
Nigerians can do. Maybe I can stop at that.
Yeah, there are so many other questions I would have loved to ask you, Dr. Hikwas, because so many issues to raise with you, but we're out of time for now. And I'm sure that some of the issues you have raised, one might find in your book, An Imperfect Storm, a pandemic and the coming of age of a Nigerian institution. I don't have all the time to ask you questions about that one for now, but I'm pretty sure that we'll have another opportunity some other time. Thank you so much for your time this morning. Dr. Chike Hikwazu is Director General, WHO for Africa, and he's been with us here virtually. Thank you again for your time.
Thank you very much.
Yeah. So when we return, let's wrap up your day.